and Barbara. We now turn to item 8 on the agenda, which is the paper on transforming care for people with a learning disability. Jane.
Thank you, Chair. So this paper provides an update on some of the work we've been doing since the last report. I talk in the paper about setting the background. I think most people are well aware of that. And also that earlier this year it became very clear that collectively we were not going to be able to deliver on the commitment made in the Winterbourne View Concordat. So over the summer we've spent a considerable amount of time pulling together a transforming care programme with a variety of different work streams, which I'll just mention very briefly. We've also, in partnership with the Department of Health and local government, put in place new assurance programmes. So we've got a new assurance board, which is co-chaired by the Minister, Norman Lamb, and also Gavin Harding, who was from the National Forum of People with Learning Disabilities. And within NHS England, we've also strengthened our governance and assurance processes. So not only have we got our own learning disability programme board, but it's also now become one of the major programmes. And so working with Karen on that, which I think is going to be really helpful, because obviously we appreciate the amount of focus that this needs. So within the programme, we've developed two different areas. So we've got one around delivering the best care now, which is about really trying to deliver on that ambition that we move as many people as appropriate into community settings. And we know that that's complex. We know that that has not happened in the past. So we need to systematically unblock some of those blocks that's stopping that from happening. And so we're focusing very much there on operational delivery, on care and treatment reviews, which I'll come back to, about improving the data and information we've got access to, about looking at how we can use NHS planning guidance, contracts to deliver. And then we're also looking at the future and how can we commission appropriately in the future, what sort of new models can we look at, both for commissioning and for funding. And I'll talk a bit about the Stephen Bubb report a bit later. And then underpinning all of that is a significant amount of work around stakeholder engagement. And you'll have heard Simon talk earlier about the employment of people with learning disability and actually allowing or enabling people with learning disability to have the same rights as everybody else in the community, which is to have a job, to live in somewhere they can call a home, etc. So we are currently finalising job descriptions and putting our application packs into easy read, and we will be recruiting 2 people with a learning disability that will help us to work on and co-design how we do our engagement. So I think that's really important. We're planning to appoint, hopefully in December, with 2 individuals starting in January. And I see this very much as actually doing what we said we want to do, which is the right thing, and about working in partnership with people, not and as many people with learning disability has said, we are experts. We are experts by experience. It's not about having a sort of tokenism. This is about truly recognising our worth and employing us to provide you with that expert insight. So I'm really pleased that we're going to be able to do that. In terms of the other progress that we've made, the paper talks here about starting to track the people that were in inpatient beds as at April 14. That has taken longer than we wanted, but we have now done it. So in the paper I talk about starting to do it. I can now confirm that we have actually done it. So we've now been able to track all of the people that were inpatients as at April 14. We now know how many of those have been discharged already, how many of them have got a plan for discharge, but we are still not at the place we want to be in terms of the numbers of people that are being discharged. So we are implementing now what we're calling care and treatment reviews, and those are a review which will consist of commissioners from both local government and the NHS, clinical experts and experts by experience, who will spend time with individuals having got their consent to have this review and challenge why people are still in hospital and look at what we need to do in order to discharge them. We've piloted that with 4. We've updated the guidance, and on page 3 you've got a list of all of the work we've done and put in place to support people to do those. And we've got training planning this week, so we're training both experts by experience but also some of the clinicians around what we're looking for. So We've currently got, over the next few weeks, over 300 of those care and treatment reviews planned. We have gone back out into with our teams in regions to ask for more, because we think that we should be doing more of those. And we will therefore then be able to track very carefully not only what are the blocks and the delays, but also what actions we need to take in order to support people to move safely into an environment that they can call home. We've had quite a lot of people that have actually expressed interest in being part of those reviews, which has been really positive. We've had great support from people like the Royal College of Psychiatrists, from the consultant nurse in Learning Disability Network, through the Learning Disability Senate, and from people like Inclusion North and Inclusion sessions, where of course we've got lots of experts by experience. So at the moment we've got around 40 clinicians identified. When I wrote the paper, we had about 18. The other thing we're doing, we've actually implemented monthly information, and in some areas now we're beginning to move that to weekly. That sort of monthly management information that we can use to track and to keep a handle on what's going on. Our monthly information is showing that the numbers of people being discharged, generally speaking, these aren't all of the people that were in as at April 14, is actually increasing, which is good. And we've got the next quarterly data, which is the really big statistical data that we publish, due to publication for the end of next week. So we will be able to see there what progress. That will be the third data point, so we'll be able to see what we've been able to deliver. And then finally, in terms of the future care design, the Stephen Bubb task and finish group that was established has now pretty much finished. The report is being finalised. It will then be put into Easy Read, and we expect to publish that by the end of this month. It will set out a series of recommendations. Both NHS England, the Department of Health, and other stakeholders like Health Education England will need to look at that, to review it, to then provide, I think, a response to that. And we have tried very hard over the last few months to engage with as many people as possible in the development of those recommendations and in the bringing together of that report. So that includes people with learning disability, their carers. It includes the voluntary sector. It includes commissioners and providers of all backgrounds. And we've also had people from NHS England and also academics that have been involved. So hopefully that will provide us with a sort of footprint for moving forwards, at the same time as we are concentrating a lot of our time and effort on actually supporting the people that are in inpatients now to move into more appropriate settings. So we've made some progress. I have to say it's not enough. We want to go further. We want to go further faster. So we are working really hard with our colleagues across NHS England and local government, the department, other sectors, to really focus and get as far as we can, as quickly as possible, for this very important and vulnerable group of people. But I'm happy to take questions, and others may want to comment.
Thank you for the update. Questions or comments? Margaret.
Thank you very much. I very much felt the passion about wanting to move forward on this faster, and obviously endorse that wholeheartedly. I was pleased to hear the way in which you gave us a picture of not just the intended collaboration around discharge, but also continuing support. What would be really useful is to make sure that we have proper oversight of the coordinated support in the long term, so that, unlike care in the community, which felt sometimes as though people were not necessarily supported into the future, that we can get a real oversight into the way in which the collaborated support continues.
I think we can do that. I can certainly come back subsequently with an overview about the whole picture, because when you talk to people with learning disability and their carers, and actually look at the evidence about what people need, health is an important part of it, but it's not the whole. And what people tell us, and is so clear when you spend time talking to people that have either been in an inpatient setting or have got a learning disability, is they want to work, they want to have choices, they want to be able to live a normal life. not be put into an inpatient setting and effectively forgotten. That's not what people want, and it's not what they deserve. And so one of the important things for us is that we need to work alongside education, schools and education, health, local government, individual sort of voluntary support and other support to really coordinate that care so people can live their lives in a community setting as far as possible.
Thank you.
Good. Jane, thank you very much for that progress report, and we're following it very closely. I know that you feel concerned that progress hasn't been as rapid as it might be, and we look forward to acceleration.